ABC News Chief Medical Correspondent Dr. Jennifer Ashton joins us with the latest coronavirus developments. Doctor, thanks for talking to us here at WMUR. I just want to know, what are you seeing right now in some of the biggest COVID hotspots in the United States?
Well, we're in touch with the CDC and the American Academy of Pediatrics and various public health officials on a daily basis here at ABC News. And what we're seeing is largely what you're seeing. We're seeing hotspots erupting all over the country with continuing very high rates of hospitalization and ICU admission in states like Arkansas and Florida and in parts of Texas. Largely any part of the country where there's a significant part of the population that is unvaccinated. And even more concerning, we're seeing a dramatic increase in the number of pediatric cases of COVID-19, unfortunately requiring hospitalization in some cases in children who had no previous or pre-existing medical conditions. And of course, this is in any age child who's not vaccinated, but also in the children under the age of 12 who are not yet eligible for vaccines. Again, all fingers pointing to this Delta variant. So we're not in a good place right now. We're seeing 4 days in a row of cases over 100,000 again in this country. And Dr. Fauci and various epidemiology models forecasting or suggesting that we could be around the 200,000 case per day mark in the next couple of weeks. Again, due to combination of the Delta variant, human behavior, and the fact that a significant portion of people still are not vaccinated.
Are we learning anything new about how exactly the Delta variant spreads?
Well, we're learning every single day, and I'm glad you phrased it that way because I think it's really important in this pandemic, but also in medicine and science, to remember that we learn every day. We have to stay humble with an open and curious mind to new information. And there's a lot we know, but there's even more that we don't know. And right now, it looks that the Delta variant is twice as transmissible as the original strain or prototype strain of coronavirus. And it may, underscore may, some data suggests, produce more severe illness. But what's really important to remember is that for people who are still on the fence about the vaccine or hearing more and more people they know with these so-called breakthrough cases, that even though the risk of a breakthrough infection is less than 1%, when you're talking about a big denominator, hundreds of millions of people, even that small percentage can become a significant number. And that's what we're seeing right now. But the vaccines are still performing well in terms of keeping people largely out of the hospital and saving lives. But again, every single day, this pandemic, this virus, this variant, keeping us on our toes for sure.
You mentioned children before. Kids under 12 are still unable to get the vaccine. What's the latest on expanding that access?
Well, we heard in the last 24 hours, the American Academy of Pediatrics is imploring the FDA to use the existing data that they have based on 2 months of clinical trials to make a decision about emergency use authorization for children ages 5 through 11 while they continue to collect and monitor the incoming data for safety signals and, of course, efficacy. And I think when you have the country's professional organization of pediatricians asking the FDA to use what they have available right now, it tells you just how concerned they are about that unvaccinated age group 5 through 11 who are becoming significantly ill with COVID-19. Again, this Delta variant, some infectious disease specialists saying it's behaving like a different virus. And we're seeing cases in that pediatric age group, including, unfortunately, hospitalizations, really skyrocket in the last couple of days to couple of weeks.
And a lot of attention, obviously, on the FDA right now. Where do things stand in terms of giving full approval to one of the vaccines, getting beyond the emergency status?
Well, I've been in touch with a senior official from the FDA in the last 2 weeks. And of course, the director of the CDC and Dr. Anthony Fauci, I'm in touch with on a regular basis. And they've all made it clear to me they are not cutting any corners when it comes to safety, but they are doing an all hands on deck approach to evaluating the data and make sure that every box is checked, even though there's an emergency setting and we're in the middle of this, again, fourth wave or other crisis in terms of what we're seeing, they're really staying laser focused on making sure that no corners are cut. So when we could see full FDA approval for the existing vaccines, in children, 12 years of age and older, maybe in the next couple of weeks. But remember, there's always that lag time. And right now, we literally don't have a lag time in terms of flexibility of weeks to months right now with what we're seeing in this country.
ABC News Chief Medical Correspondent Dr. Jennifer Ashton, thank you for your time and your expertise.
Thanks for having me.